Good afternoon, everybody. I think first I must express my gratitude to Professor Gupta for this opportunity. And seeing this particular forum, Patient Union Conference, I think patient is the most important for every doctor. I mean, that's why what can you do best for the patient? Of course, I think as Dr. Paul probably tried to mention, how the patient can also contribute to improve the system or the care. But I think time being limited, I'll just stick to the post-COVID issue. And I think this was one pandemic which I think foxed the medicine. We didn't have, the way it came, even the advanced countries, what we are seeing in Europe, what we are seeing in America, the kinds of death which were occurring in the period when this pandemic came. So that only showed that medicine was not been prepared to handle this kind of pandemic. Of course, it's also another issue was that the vaccine, which normally takes 10, 15 years to come, came within 1 year. So that was, I think, probably the thing which came much earlier than even we had a drug to take care of COVID. Now, the limiting to the post-COVID issue, and being a cardiologist, a limit to the cardiology post-COVID symptoms, you see, usually they say the post-COVID, once somebody has a COVID, first 3 months, first 6 months, 30 to 40% patients may have some kind of symptoms, and all organ has been shown to have some post-COVID symptoms, whether it's neurological, cardiology, gastric, endocrinology, skin. So all there are sort of, and 30 to 40% patients, but usually they say the post-COVID symptoms have been disappearing by 6 months. Unless somebody has been in the sort of very severe lung issue, in the ICU or ventilator, they continue to have more longer even lung issues. As for the cardiology, the main symptom that we came across patient following COVID mainly was palpitation. It was unusual. Everybody, most in the females than in the males, the tachycardia. And particularly like postural tachycardia, that when you stand up, you get palpitation. So this was something very unusual in this COVID phase. And of course, I think gradually people with some kind of small medication used to settle down. Some people felt that they had a hypertension which was not there, which came after the COVID. And of course, those are the ones which probably continue to have hypertension. So maybe COVID resulted or unmasked what they were prone to, kind of thing. The other issue is main of a heart failure. That was one issue which I think became that it may be virus, which may be causing myocarditis, what we call inflammation of the heart. And they may lead to cardiomegaly and heart failure kind of thing. That is one issue which one was the mechanism was either virus affecting the heart or that inflammatory response to the virus that was causing myocarditis. And another was acute heart attacks. I'm sure all of you must be knowing those days there was a kind of acute, young people getting acute heart attacks, thrombotic issues. So these were the acute episodes they were coming. Of course, some patients continue with shortness of breath, the symptoms. But we didn't have a real scientific data to say that was anybody getting myocarditis. That is inflammation. I think even autopsy did not, there are some autopsy did indicate, but this was not a very convincing data. Even MRI done in these patients showed that maybe having myocardial inflammation in the short period, but long period it was not that it resulted in any kind of heart failure. So main is palpitation, hypertension, and the one issue was which became that patient having acute heart attacks. And even people were blaming vaccine. There was, I think, in the social media, lot of things. The vaccine has caused acute attacks kind of thing. But as far as the scientific data goes, except mRNA vaccine, there has been some thrombotic episodes like brain stroke or maybe acute cardiac stroke. But the vaccine that was used in the country, Covishield or Covaxin, there was no convincing data to show that there was any proneness to acute heart attacks because of the vaccine. Possibly the disease. The ICMR study which showed that people who had COVID and long period, they were more prone to acute heart attacks than those who didn't have COVID. So I think, and so these are some of the issues which, but I think fortunately we are now out of COVID for 2 years plus. There are very few things, probably people are now not blaming COVID Earlier, every symptom that every patient will come, we say post-COVID हो सकता है. I don't know हो सकता है नहीं हो सकता कहना मुश्किल है. Everything was clubbed into the post-COVID area, but I think it's good that we are out of it, and I hope that we stay out of it and we don't have to face. But I think this particular endemic has taught us one thing, that the system has to be prepared for any future kind of things, that we cannot ignore that aspect. You never know which day. Now we have been today don't know whether this virus was from the lab or from the outside. It's not still clear. I mean, all kind of things come. So thank you so much, sir, for this opportunity.